Good afternoon, everyone. Here we are for our demonstration of Kybella, which is the newest thing on the market for the treatment of submental fat. Prior to this, patients with this problem were destined only to have liposuction. Now we have a much less invasive way of treating fat beneath the chin. So today we have Kitty, and Kitty is going to take just a minute or two to tell us what it is she sees and what her concern is.
Well, I think my skin's in really great shape because we've been using all the skin products and treatments, but I'm finding that my neck is not keeping up with my anti-aging. So I really feel that my neck is where I'm showing the most problem. I feel that it's fuller than it should be, and I just think that's one of the first things I see.
Okay, very good. And Kitty put that very elegantly. Many patients have that problem. They feel like their skin texture and tone is intact. However, their neck shows signs of aging, which they find disconcerting. So Kitty, today we're going to talk a little bit about the use of Kybella. And Kybella is essentially a bile acid that is injected beneath the chin, which dissolves the fat. One of the things we look at is we want to make sure that the patient has good skin tone. For good skin retraction, we want to make sure that the patient is a good candidate for the use of Kybella. And then we want to specifically hone in on the area that we're going to address.
Okay.
In Kitty's case, we're going to make an outline of the jaw. We're going to come sort of a short distance inside that outline because there's some critical nerves and blood vessels that run in that area that we want to avoid. And then we're going to focus on the main area of fat that we want to dissolve. Having outlined that, we're going to now place a grid, which will then enable us to track the amount of injections we place in each area. For the administration of Kybella, we do place a topical anesthetic, which Kitty already has in place. After this, we will be injecting some local anesthetic, which will make her a lot more comfortable during the procedure.
Let's record that.
There for 1 moment. Hold on to that side.
Now we're applying Kitty's grid so we can keep track of exactly where we're injecting. How are you doing, Kitty?
I'm fantastic.
Good. So now we've established Kitty's grid. We've identified our landmarks. As you see when I pinch, this is the concentrated area of fatty deposit beneath the chin, which tapers off as we go out in either direction. So Beverly, you have our, Kitty has now had some local anesthetic. Are you starting to feel a little numb in that area, Kitty?
Slightly.
Okay. And that's usually what we don't want to put an overabundance of local. It's just enough to make the patient feel comfortable. So today Kitty is going to get 0.2 2 vials of Kybella, and there's 1 vial in each syringe. This is Beverly. Beverly is helping us inject Kitty today. Okay, so we'll start off with the grid. Again, it enables us to keep track of exactly where we're injecting. Kitty, how are you doing with these injections?
I can't even feel them.
Note that the area that we are injecting is well away from any important nerve or blood vessel structures and is concentrated mainly over the area where we need to get rid of fat. Typically most patients will see some results after the first injection, but mainly after the second injection is when you see the most dramatic changes. How are you doing, Kitty?
Great.
She will experience some swelling, which is variable, can at times last 2 to 3 days in some patients, and in some patients very minimal swelling. And that's been my experience. It's sometimes not always able to predict who will swell and who will not, so we tell the patients to expect some swelling. That way they're able to prepare in terms of their social schedules. So what we're doing here is we're just tapering off so Kitty gets a nice sharp jawline from the injection process. And then we're going to come back to the very depths of the midline. I'm going to pinch this, and again, this is my own technique. We get right into that deep central area of fat and inject as safely and as deeply as we can. So, Kitty, how was that?
A breeze. It was really much easier than I thought it would be.
Okay.
Very much so.
So, over the ensuing few days, it is okay to take some Tylenol. We don't use steroids or any of that because the whole idea behind this is that Kybella creates some inflammation, and that is what aids to the resolution of the fatty deposits in the neck. We will see Kitty's photographs at the seminar, and we'll keep you up to date as to her second set of injections. Thank you, Kitty.
You're
You
welcome.
did really well.
Thank you.